So I'm Dr. Biri. I'm MS orthopedic surgeon. I'm currently working in Holy Cross Hospital, Tura. So this camp was organized with the help of, especially the government came to us searching for a place where they can operate clubfoot patients. So there are so many deformed children who are not able to walk properly in Garo Hills. So they approached us saying that they want to make use of the theater, plus they want to make use of the services here to operate on those patients. So they came to us with a proposal last year, and then they said that the doctors will be coming from Bangalore for surgery. So we agreed to that. So this is the second one. The first one we had conducted a camp in February. Now this is the one we started on Monday. I did this on 26th, and then ending tomorrow. So this time also, last time 15 patients were operated. This time 13 were operated. So yeah. So this time from Bangalore, there are 4 orthopedic surgeons came. They are pediatric orthopedics doctors, and then 2 anesthetists. So 6 of them came this time. Last time 5 of them came. So they came and they did a good job. They've done the part and go. So once they go, we follow up the patient here. Clubfoot is a little difficult to treat condition. It's not a one stop where one surgery is done and then it's complete, nothing like that. We have to follow up the patient, we have to give shoes, we have to keep on plastering. So all those things the care will be continued in this thing, and I'll be continuing the care in this hospital. And one thing which I want to say is that, like, most of the patients, if they come to us early with clubfoot, as soon as they're born, that means they don't need surgery. So those people whom surgeries are not needed, we do it here only. We give the treatment here without the need for outside doctors. But those children who are older, who neglect the cases, which can't be treated with plastering or shoes alone, then we give the patients for the Bangalore doctors to come and operate. Yeah, so the government has came with a proposal saying that whatever expenses the patient incurs in the hospital, they will return it back. So right now, the treatment, everything the hospital is doing for them, even the food is free for the patient. The travel is being taken care of, and then all the medicines and all. Right now, the hospital is giving for the patient, but afterwards, I will send the bill to the government, and then the government gives them back. So the first camp, everything is cleared by the government, so it's going on well. It was done in February this year, 2023. Yeah. So this camp is organized by the government of Meghalaya with an office called DEIC office. So this DEIC office, what they do is they find out children with deformities, with heart disease, with lung disease, with cleft lip, cleft palate, all those things. They identify children from all over Meghalaya, but for Tura it will be for the Garo Hills, and then they send this patient to different parts. Like for heart diseases, they take the patient to Kochi. Their travel is free, their treatment is free, their surgery is free, everything is free, and then they bring them back for the surgery. For cleft palate, they do the same thing. They take them to Kolkata or Guwahati. For this clubfoot, before they were doing outside, but now since we have the facilities here, it's much better and convenient for the patients also, and for the office also to conduct here. So, like, the main motive is, if you ask me about the main motive is so that the government has a program where all the children with deformities can be treated. So that's what we are doing. That's the main motive, to treat the disabled children so that they can walk again properly through this camp. No, because it needs a good setup. First thing is, the doctors, outside doctors, they can come and operate and go, but the continuity of care should be there. So one orthopedic doctor or orthopedic surgeon needs to be there in the hospital to take care of any problems or after care. Plus, to operate, it needs lots of equipment. Yeah, so in Garo Hills, there are only 1 or 2 hospitals, Civil Hospital and Holy Cross Hospital, which are equipped with this kind of equipments to do the surgeries. Equipments both for the surgery and for the anesthesia. So this cannot be done in a setting where there's no proper equipment. So before starting the treatment, we have done a screening. So around 54 patients were identified. So in the first, as I said, in the first camp, around 15 of them were taken care of. This time 13 of them were taken care of. Now remaining are there. So we have to conduct one more camp to finish off the screening. Now what I want to say is that we want to create awareness among the people so that more people, especially those who are in the villages, those who are taking local treatment, to come so that after this third phase we'll do another screening so that more people can come and get benefited through this camp or through this surgery camp. So like according to the medical, they say that out of 1 in 10,000 children are affected not only with clubfoot, but we call it packaging disorders of the leg. So 1 in every 10,000 kids are affected. But I think in Garo Hills we find it's a little bit more because we are treating lots of newborns also with all these deformities. So and then the problem is that in other places the treatment had started long time back. So now they are getting only new cases. So it feels like there are less patients. But here there are lots of backlog cases. Like many years it has been neglected. So like suddenly we are picking it up. So we find that so many neglected cases are there. 18 years, 20 years, 25 years. So all those things, if you combine all, we find that it's actually more than what we find outside elsewhere. Yes. So as I said before, the hospital needs an orthopedic surgeon. So I'm there here in this hospital. Plus we need a proper operation theater. So we Holy Cross Hospital, we have 3 functional operation theater with like the C-arm, a good anesthesia machine, and the orthopedic drill, orthopedic saw, and all the other small instruments. Everything is available in the hospital. So this hospital is quite well equipped to take care of such patients. But in the Garo Hills, as I said, only civil hospital and Holy Cross Hospital are equipped to undergo this kind of surgery. And I think the civil hospital, they are quite busy with other regular patients. So I think they chose this hospital accordingly. That's what I think, but you have to ask the government officials why they chose this place.